How do you know when you're getting better once you've started alternative approaches to manage your uveitis? It depends a little bit on the type of uveitis you have. So some types of uveitis, including intermediate uveitis, your main symptoms would be floaters. So once you start the alternative approaches, if you're getting results, first thing that should happen, you should not be getting any new floaters. And then secondly, the existing floaters should start to diminish. And we have a lot of patients where precisely that happens. If you have, let's say, anterior uveitis or panuveitis, some of the other types of uveitis, you should see a dramatic reduction in either the severity of the uveitis or the frequency, or both. So you should be getting less severe uveitis, and by less severe, meaning it should be easier for medical therapy to deal with it. So perhaps in the past, when you had a uveitis flare-up, it would take about 6 to 8 weeks of, let's say, Predfort or dexamethasone or some other steroid, and then you should be getting to a situation where within a couple of days or so, once you start to really improve and address the root cause, it should be clearing up very, very quickly. The question I'm often asked is, can you rely on symptoms alone? So for example, if you're getting less flares, less severe uveitis, can you take this as a sign that it's working, or should you also be going to your ophthalmologist to confirm? You should be going to your ophthalmologist to confirm. So I have enough experience now of my body and dealing with uveitis that, and I had enough flares over time, but I know it immediately if I was having a uveitis flare. But I also know when my uveitis is completely under control. But that comes also as a function of not only knowing your body, but also the type of uveitis that I had, which was anterior uveitis, where the main symptoms tend to be, so aversion to light, so the photophobia, really red eyes, and a lot of pain. And just quite simply, when I don't have those symptoms, I do not have uveitis. So whether you have intermediate uveitis or you have panuveitis, posterior, anterior uveitis, it's definitely a good idea to keep a very, very close relationship with your ophthalmologist, to go there frequently, and as you're undertaking these alternative approaches, just to see clinically how well these are working for you. Do not just rely on your symptoms, do not rely on guesswork. Even if you know your body quite well, I always like to say, trust but check. So yeah, that's it. Thank you.